Hey everyone, this is Dr. Izrab, and in the beginning I want to apologize for not posting for a long time. I know you guys been great and you stuck with us all this time. I know this past year has been tough on you, on all of us. It has been particularly tough on us in Integrative Kidney Solutions. So again, I want to apologize. There's no excuse, but hopefully we will be posting more regularly for you. We have great content prepared, and we're excited to present it for you in our new branded slideshow that you're going to see from now on our channel here. I want to say that beginning February, we will be starting to post every other week, and you can expect us to have a new video on every other Wednesday. So stay with us, and thank you again for staying with us all this time. And today on this video, we're going to be talking about a concept which is actually the basic concept of why we are doing this. And really the first word in integrative kidney solutions is integrative. So I want to talk about integrative medicine. What is integrative medicine? And probably some of you know what it is, but it's a good refresher to talk about it. And we're going to be talking about the principle of our integrative medicine and integrative kidney medicine approach that we use. So we're going to talk about that in several upcoming videos. So today we're going to talk in general about integrative medicine, and in future videos I'm going to be talking to you about the principles of integrative kidney medicine and what we are teaching about and what we are promoting for the care of kidney patients. So let's do this. All right. So I don't know if you guys know me, but I'm a nephrologist practicing for more than 15 years, and I'm also a functional medicine certified. And you know, when you talk about nephrology, you want to remember to make that distinction between nephrology and urology. So we're the one dealing with kidney disease and interaction with the body and dialysis and transplant, while the urologists are kind of the surgeons of kidneys, and they deal with issues related to surgery, cyst masses, obstructions, and so on. And really the reason why we're talking about all of this, because I am really very passionate about trying to end this chronic kidney disease, what I call the chronic kidney disease epidemic. We see that 1 in 7 or 1 in 9 people have kidney disease. And according to the CDC, 1 in 7 people in the United States have chronic kidney disease. And worldwide, depending on the study, about 10 to 15% of the world population has CKD. So why we're talking about integrative medicine, and what is integrative medicine? And we can't talk about integrative medicine before we talk about our current medicine, which I call conventional medicine. And conventional medicine basically really evolved in the beginning of the 20th century, when scientists started utilizing the scientific method to medicine. So basically, they came up with research, and that research applied the scientific method, and then depending on the research finding, you create training, and you start having universities and medical schools that train based on this research. And then you apply that research and training into practice. And as time went by, you end up starting to divide medicine into practices, into specialties and subspecialties. So you have nephrology, cardiology, neurology, and even those specialties have their own subspecialties. But the person and diseases in general do not follow one organ at a time. They don't pick a specialty and decide this is how they're going to happen. So what integrative medicine looks at the person as a whole. So when we talk about conventional research, how it's being applied, and I'm not really saying that research is not great, because research is definitely important, but current day conventional research is not perfect. And the reason why I'm thinking and I'm talking about that, and I believe in that, is because it does apply scientific method on a dynamic human body that is interacting all the time with each other, and every organ has interaction with others, and chemicals in the body are often in a continuous movement. And what conventional research like to do is to isolate one thing, isolate a drug or a nutrient, and try to find out if there's a benefit or a harm from it. And it uses specific criteria, so they include specific people and exclude specific people depending on their criteria, and then come up with statistical numbers and look for averages to come up with their results. And these averages can sometimes are lumping averages of many individuals, but every person is different. So when you don't consider genetic differences, lifestyle exposures, then you are not, that some of these results may not be relevant to the patients that you're taking care of. And then you try to apply that research into training, and you end up with medical training that is not perfect either. And I listed here, this is a great article that identify why current evidence-based medicine is not perfect. And then you end up going to practice, and you have a model of practice where the doctors have limited time to spend with their patients, and within 10 to 15 minutes they have to identify what the problem is going on and come up with a treatment for it. So you end up with symptoms of a complaint, and you end up trying to find a treatment for that symptoms or complaint with your best known evidence. So instead of ending up finding the cause of a fire, the conventional medicine is trying to put down fires. And that ends up causing the patient to live with their chronic diseases instead of finding a cure to their diseases. So the person is actually not only symptoms or drugs that need to be given within 10 to 15 minutes. They have genetic background, they eat certain things, they have cultures, they're taking some medication that may be affecting them positively or negatively, they have different lifestyle, they have different communities, they have different relationship, and the conventional medicine tend to dismiss botanicals and manual medicine, which can sometimes play an important role. So integrative medicine look into all this and combine them together to care for the patient. So integrative medicine, again, integrate all aspects of care to come up with an individualized approach to care for that person in front of you as a whole. And this is a great caricature that you see the doctor is wanting the patient to meditate for 20 minutes twice a day, exercise, and avoid processed food, eating organic, and spend time in nature, and stop worrying, and so on. So, it's not about just drugs. And when we talk about integrative kidney medicine, we talk about a medicine that integrates all aspects of kidney care to individualize the care of a person as a whole. It is individualized medicine, but at the same time, it is comprehensive. So I hope you like this video, and this is the first in series of videos, as I mentioned, that are going to talk about the chronic kidney disease epidemic and also about the principles of integrative kidney medicine. So I hope you follow us on Facebook, Twitter, and Instagram, and on www.inkidney.com. Don't forget to subscribe to the channel. Would love to hear your feedback. Please put your comments and keep giving us feedback so we can improve for your benefit and for ours.